and welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluations at the close of today's broadcast. Continuing education credits are available after you complete our short post-test, and your feedback is always helpful to us in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best meet your needs. As for today's program, we will be taking questions throughout the hour. Our toll-free number is 1-800-452-0662, and you can also submit written questions by fax. Our fax number is 518-426-0696. You can also email us questions at any time throughout the hour at phlive.ny@gmail.com. Today's broadcast is Sugary Beverages, Why the Fuss and What You Can Do About It. Our speakers are Dr. Ian Brissett from the New York State Department of Health and Melanie Shefchik from Rockland County Health Department. Welcome. Thank you both so much for being here.
Great.
Thanks for having us.
Glad to be here.
We're very excited to have you here, and I know you both have a lot of interesting information to share with us today. But before we get started, we're actually going to hear from Dr. Kelly Brownell of the Yale Rudd Center on Food Policy and Obesity. We had the opportunity to meet with Dr. Brownell prior to today's broadcast to hear from him about the scope of this public health problem that's facing our nation.
There are a number of concerns about sugar-sweetened beverages. Chief among the concerns is the link between consumption of these beverages and risk for obesity and diabetes. There's study after study after study shows this relationship to be true. But there are a number of other reasons that people are quite concerned about these beverages. They carry no nutrition at all. There is the addictive potential for consuming sugar. And then also there's the known addition of an addictive substance in high amounts in some cases, namely caffeine. And you put all this together, you can see that these beverages are bad actors, and it's no surprise that public health authorities are worried about them. Overall, Americans are consuming a lot higher percentage of their calories in liquids than they used to. It used to be milk, a little bit of sugared beverages, and water, but now there are whole new categories like vitamin-fortified waters, energy drinks, sports drinks, and the like. For about 15 years, there's been quiet research done about the addictive properties that food may have. And people have begun to wonder what goes on in the brain when people are consuming certain foods. There's been a good bit of research on sugar, less on other nutrients, but a lot on sugar, showing that it can act on the brain very much like traditional substances of abuse, things like cocaine, heroin, morphine, alcohol, nicotine. Nobody claims that it has as big an effect, that it's as addictive as these other substances. But the question is it addictive enough to create a public health menace? You know, when I was a boy, sugary drinks were few in number and small in portion. So there were a few flagship beverages, Coke, Pepsi, 7-Up, and a few things like orange and grape drinks, but that was about it. And they came in 8-ounce bottles. And people tend to consume whatever is in a package, bottle, or a box. It's called unit bias. And so when I was a kid, when you had a Coke or a Pepsi or whatever, you drank it, the event was over after 8 ounces, and you might not have had another one for a long time. Now the event isn't over until somebody's consumed all of that 20-ounce bottle, or even bigger in some cases. So the fact that these are so ubiquitous, there are so many of them, they're available everywhere, vending machines all over the place. You know, gas stations now have become eating opportunities. Drugstores are eating opportunities. You just see this all over the place. And the fact that the portion sizes are larger and driving people to consume more makes it not at all surprising that public health officials have turned their eyes to these sugared beverages as public enemy number one.
Dr. Brownell, it was so great to meet with him. He's a really great resource on this subject. But I know that you're a really great resource too, and I'm excited to hear from you today, Ian. This whole topic, there's just way too much to cover in the scope of an hour. So why don't we start by hearing from you about what do you actually hope for us to cover within the time that we have together this morning?
Sure, Rachel. I'd like to start by demonstrating and talking about some of the data sources that we use to conduct public health surveillance on sugary drinks and sugary drink consumption. I'd also hope to touch on and demonstrate how this data can be used to focus our public health planning. And then also, in the context of doing this, I want to demonstrate and hope to convince you that ongoing data collection is a vital part of the public health response to sugary drinks.
Sounds like we've got some interesting conversation ahead of us. Now, where did all of these efforts come from? Has there been research done that illustrates the nature of the problem that we're talking about today?
Absolutely. Just to touch on what Dr. Brownell had discussed before, there have been numerous studies in the past decade in the scientific literature demonstrating the association between sugary drinks consumption and negative health outcomes. These are prospective longitudinal studies, meta-analyses that combine multiple studies together, and they demonstrate clearly that regular sugary drink consumption, often defined as a little as 1 12-ounce serving per day, is associated with negative health outcomes, including weight gain and obesity in children and adults, and also cardiovascular disease and development of type 2 diabetes in adults. The consistency of the findings, the quality of the studies, the plausibility of the biological mechanisms linking behavior to these health outcomes have contributed to why experts like Dr. Brownell have identified sugary drinks as something that's worthy of our attention.
It certainly sounds to me like it's worthy of our attention. But has this been an ongoing problem, or is this something that we're seeing people consuming more of these beverages now than they once did? Why are we talking about it now?
Well, if you look at the data over the past 30 years, it's clear that the number of calories that sugary drinks compose of our diet has increased dramatically. So the figure up shows that from 1977 to 2006, among adults per capita, there's been an increase of about 120% in terms of the number of kilocalories we consume per capita. And among children, it's around 75%. So this dramatic increase, coupled with the scientific literature, have really identified or triggered that this is a public health concern that we need to address.
Yeah, those are some pretty startling numbers, 120%. That's, when you put it that way, it's hard to ignore that.
The facts don't lie.
Absolutely. So you wanted to talk to us today about surveillance efforts. Can you start by just talking to us a little bit about what do you mean by surveillance and what goes into that process?
Sure. Public health surveillance is a core primary function. It refers to the ongoing collection, analysis, interpretation, and dissemination of data, really to craft our public health response. And in this case, coupled with the data that we saw, we realized that there was an acute need in New York State for us to develop our surveillance infrastructure around this sugary drink so that we could plan and then track the success of public health initiatives.
Okay. So what specific needs are being addressed right now in your surveillance efforts?
Sure. We start with the basics. One of the needs is to understand how this risk behavior varies across the segments of our population, across the state, and then over time. So in epidemiology, this is often referred to as understanding something over person, place, and time. Second of all, there was a need also to understand some of the socio-demographic, the behavioral, environmental characteristics that contribute to and sustain the behavior. And then also, as we move forward, data is vital for us to plan our public health activities, and in the long term is necessary for us to understand whether our investments and our initiatives are contributing to a solution. So for tracking the changes in this behavior over time, data is essential.
Sure, it certainly makes sense to me. Now, let's talk more specifically about surveillance efforts in New York State focused around sugary drink consumption.
Glad to do it. To establish surveillance for public health surveillance around sugary drinks, we added on to an existing surveillance system, our Behavioral Risk Factor Surveillance System, or BRFSS. The BRFSS is an annual survey that really represents collaboration between states and our partner, CDC. So the BRFSS is an annual random digit dial telephone survey of households and cell phone only residents. It's sampled such that the data allow us to project onto what's the population of adults, and in this case we'll be talking about data around children as well. It's a surveillance system that we've used in New York State for over 30 years to track behavioral risk factors that can be modified. And in 2009, we added questions that would expand this existing resource to assess and track sugary drink consumption.
Great. So it sounds like a very comprehensive study. It's been going on for quite some time. What can you tell us about some of the questions that are asked in that survey?
Great. I'd like to, just for context, talk about two questions that we've measured. So the first question that should be up on the screen measures regular soda consumption on a daily basis. And then also a second question assessed consumption of other sugary drinks. And again, Dr. Brownell had referred to the fact that it's not just soda, it's these other sugary drinks. So we catered our questions to make that clear distinction. Now, these questions were asked of every adult respondent who participated in the BRFSS, and then also adults that had a child over 18 in the household. They were asked to ask and answer these questions about a randomly selected child. And again, because of the design of the survey and our ability to weight the data, we could project from the sample to estimate characteristics of the population of adults and children about their sugary drink consumption habits.
Very interesting. So now, what are some of the results that you were able to obtain from asking those kinds of questions?
Sure. So the graphic up there displays 3 different indicators that we've calculated. The first is the daily consumption of 1 or more regular sodas. A second indicator we track is the daily consumption of 1 or more other sugary drinks. And the last set of bars, again, it's adults and children, sort of collect or refer to a composite variable. So it's 1 or more sugary drinks or regular sodas per day. And starting with the left side of the graph, among adults, you'd see that regular soda consumption, so 1 or more per drinks, is actually more prevalent among adults than children. But when we move across the graph to look at the consumption of these other sugary drinks 1 or more times per day, you can see that the prevalence is much more common among children under 18 than adults.
Which is really some interesting findings. And I think you've got another chart that tells us a little bit more even about the relationship of age to consumption of sugary beverages as well.
Absolutely. So if we break down age with a little bit more granularity, let's first focus on the data on children. Even among children 2 to 5 years old, daily consumption, about 25% consume 1 or more sugary drinks per day, and this increases to nearly 40% among the segment of kids 2 to 17 years of age. Shifting to adults, consumption is most frequent among the younger age segments and decreases in a linear fashion over time. So the least consumption, least prevalent among adults 60 years and older. So again, what this provides us is information about who in the population are consuming these beverages.
Right. So in addition to looking at variances by age, did you find that there were differences in terms of gender and consumption of sugary beverages as well?
We did look at this, and it differs by adults and children. So when we're looking at among children, there's no statistical difference in the consumption of sugary drinks among boys and girls. But among adults, we do find that adult males are more frequent consumers of sugary drinks than females.
Okay, and what about, did you find differences in race or ethnicity or income level? Did that affect people's consumption levels of sugary beverages?
We did. So like with so many health risk behaviors, we did find very striking differences and disparities by race, ethnicity, and household income. So when looking at the data by race, ethnicity alone, consumption is much higher among non-Hispanic Black and Hispanic populations when compared to non-Hispanic whites. And we see a similar gradient of household income and sugar drink consumption. So sugar drink consumption was most prevalent among the population with a household income below $25,000. And again, what this data focuses us on is these are the populations in need.
Right, and that makes sense. So that way you have a better idea of who we're going to target when you're doing interventions, right? Because you talked about surveying and then using that data to plan our interventions. So
absolutely. It's a fundamental part of the process to understand what the distribution of this risk factor is in their population. We don't have the resources to address the entire population always with our interventions, and surveillance data identifies where the need is greatest.
Excellent. So you've provided us with a lot of specifics and a lot of information so far. Can you break it down and maybe summarize for us some takeaway points of the data that you've just provided what are kind of the key things that the audience should focus on?
Glad to. So starting out, we find it's really striking that when we're looking at sugary drink consumption among children, the consumption of these other sugary drinks is 3 times more prevalent than the consumption of regular soda. So in terms of what are the sugary drinks that children are drinking, it's these other sugary drinks, not soda. We think it's also looking across the entire age spectrum. Its consumption is highest among children age 12 to 17 and then tails off among adults. Again, among adults alone looking at it, consumption is more frequent among males than females. And then looking across our entire population, as I've stated before, consumption is greatest among younger adults, adults that are of Hispanic ethnicity, and also that have lower household income. So I've been able to talk a little bit about the data that we collect on consumption and what we think it's a vital in planning our programs and long-term tracking the success of our initiatives. I'd like to, if I could, start to talk about some of the other surveillance and data collection efforts that we undertake, and again, project how it influences our public health actions.
Sure.
So when we look at sugary drink data, it is clear that as a population, we're over-consuming these beverages and the excess calories that they have with them. What isn't clear, and again, it's been stated in a number of important scientific articles, is that what we refer to as the beverage environment plays a very critical role in influencing this behavior and also explaining some of the disparities that we see. So looking at it, as Kelly Brownell had, Dr. Brownell had stated, these sugary drinks are ubiquitous. They're highly available. They're heavily promoted. They come in these large container sizes. When we're thinking about how to deal with an individual behavior like sugary drinks, from a public health perspective, it's important to recognize and remember that this is rooted in the environment, and it's to address this individual behavior makes sense to look at the beverage environment as a potential for intervention.
Sure. So if there are these different factors, both the individual risk factors and then considering the environment that the beverages are promoted in or available in, what's the best method? I mean, as a public health official, what's the best way to really address this problem?
Well, one way we can think about the spectrum of activities that public health can take on is to think of them in terms of a pyramid. So up on the screen you've displayed, we can think of the public health response to any health event like sugary drinks in terms of a pyramid. So on the top of the pyramid reflect sort of these more intensive person-to-person activities. As we move down the pyramid, the expectation is that activities can have more impact because of their ability to reach larger segments of the population. It has always been historically the goal of public health to work at this environmental level and take action to make the default behavior a healthy one. So in the case of sugary drinks, this means taking on activities that reduce their availability and their promotion, and also promote healthier beverage choices like water as alternatives.
Now today we're sitting here talking from a public health perspective, and we can all see the value in doing this. Has there been any research about what does the general public feel about this? Do they have opinions on this issue?
Well, we collect that as part of our surveillance work as well. Unfortunately, I'm not going to have the time to talk about all the activities that we take to assess the sugar drink environment, but I would like to focus on some of the activities that we've done and data collection we've done to ascertain the public's beliefs and support for potential actions to reduce the prominence of sugary drinks and promote healthier alternatives. And I'd also like to focus on some data that we've collected around public beliefs, especially about the health benefits or harm of sugary drinks and how it relates to some of the behavioral data. So the second data collection I'd like to talk about was a poll, a public opinion poll that was conducted in conjunction with Siena Research Institute. It was completed last year on around 1,200 residents. And as you see, it was sampled to produce population estimates with a relatively high degree of precision, about 2.8%.
Excellent. And can you share with us some of the specific questions that were asked in this particular study?
I will. So the first question that will come on the screen is a question that we used to ask about the public's beliefs about the appropriateness of children consuming different types of beverages, not just sugary drinks, but a number of them. And we were specifically asked in their opinions about the health or harm for children from 2 to 12. And the question was worded to ask about whether they thought there would be a harm or benefit for a child drinking one or more of these beverages per day.
Okay, so if you were asking, did they find it harmful, did they find it beneficial, what did the results show? What was the general public's opinion on this?
Well, from the graphic displayed, you'll see this displays beliefs about 6 different beverages that we asked about. And what I really want to focus on are beliefs about soda relative to other sugary drinks. So when we're looking at the data concerning soda, 87% of the public identified that it would be harmful for a child 2 to 12 to drink this sort of beverage. But when we're looking towards sports drinks, actually a much larger segment of the population, 41%, indicated that they would see, that only 41 indicated that it would be harmful for a child 2 to 12 to consume one or more of these beverages per day. Again, on the other side of the spectrum, only 1% of the people polled, as expected, would indicate that there would be a health benefit for a child consuming beverages, a soda, one or more sodas per day. But when we're asked about sports drinks, nearly 20% indicated that they thought there could be a health benefit to a child the same age to drink one of these beverages. And this is a striking difference, and yet the caloric load that these beverages have is often very similar. So in terms of moving this forward, we saw this discrepancy as an important opportunity for our public health messaging.
Yeah, I mean, it certainly seems like an important message to me because I think the marketing really does kind of promote it differently. And you do think of soda as being more harmful than a sports drink, which don't we need that to replenish ourselves?
Absolutely.
So now the findings also show some really interesting information about the relationship of age to what types of drinks children are consuming. And it relates back to some of what you talked about earlier. Can you just expand a little bit on that for us again?
Sure. Looking back to the data that we collected on consumption from the BRFSS, if you recall, I pointed out what children are drinking regularly, and there was this disparity where children are drinking these other sugary drinks more than they drink soda on a routine basis. And we think that there's a clear connection between these findings and the polling data. So it's very evident that adults and parents view these soft drinks, sports drinks, as being different. And again, as we refine and think about addressing sugary drink consumption, it's very clear that if we want to address it among children, we need to tackle this understanding that sports drinks somehow represent a healthier alternative to soda.
And now, did you also ask questions about how people felt about restricting access to the sugary beverages?
We did. So again, one way in which we could shape or change the environment is restricting access to these beverages, and clearly the data says if we were going to focus on a population, it would be children. So we asked questions that ascertained the public's opinion about banning the sales or restricting serving of these sugary drinks in key settings, child care setting, elementary, middle, and high school. So we asked a simple question for about these different settings, assessing the public's support for taking action to restrict these beverages in these settings.
And what kind of things did you find in conducting that survey?
Well, we found that overall, with the exception of high school, there was strong support for the public taking action and school districts to ban the sales of these beverages from elementary and middle school, and then also restricting them from child care setting. So there was very strong public support for taking action to change the sugar drink environment in these settings.
Interesting. So on the flip side of that, we see that there's some public support for restricting access, but you also looked at the other side and not just restricting access to the unhealthier choices, but maybe promoting access to healthier choices. Can you talk a little bit about that?
Absolutely. As we said, the environmental approach really is to try to make the default action, the regular action that we do every day, the healthy choice. And one way in which this could be done is through something like kids' meals. So we asked the question whether the public would be supportive of making the default that comes with a child's meal be a healthier alternative and not allowing that to include soda or sugary drinks. So what we saw on the screen was the question we used to ascertain public's opinions about this potential strategy.
And what was the public's opinion about that potential strategy? What did you find?
Well, again, in the graphic should come up, you'd see that there was overwhelming support. Well, overwhelming, the majority, about 62% of the public, supported taking this action. And what we found is that support was particularly high among ethnic and racial minorities, and then also low-income New Yorkers. And we think this is important because our BRFSS data suggests that this is a group that tend to be high consumers of fast food. And then also looking back at our consumption data, they also tend to be high consumers of sugary drinks.
Well, once again, Ian, you've reviewed so much data with us that you've found from doing these surveys. It's tremendously helpful. Are there any particular takeaway points or a way that you'd like to summarize this information of what the viewer should really focus on, the main message of everything you've shared?
Sure. So far, just to focus on three main messages. One is that it's very evident that sports drinks and other sugary drinks are viewed differently than soda. And again, just to reiterate, I think this is an important challenge for our public health messaging and public health education work. Second, it's very evident that the public supports school districts taking action to remove and banning the sales of sugary drinks in elementary and middle schools, and also restricting them from being served in childcare settings. And then finally, we do find strong public support for taking action to make sure that the beverage that accompanies a kid's meal is a healthier alternative. And most importantly, support was particularly strong in the segments of the population that are high fast food consumers and also sugary drink consumers.
Well, Ian, thank you so much. You've shared so much information that I know I find very interesting. I'm sure our viewers do as well. You know, we're taking questions throughout the broadcast, but in general, if people have more questions, want to get more information on this topic, are there resources you would recommend that people look at or visit in order to find out more?
Well, with respect to the data that I've presented today, the web links show here some of our broader surveillance reports on the topic for adults and children that are available on our public website. I've also included a link to other reports from our behavioral risk factor surveillance system. We also track other modifiable health behaviors, receiving a flu shot, colorectal cancer screening, other health risks. So that link is there. And then for those that want to access the raw data on sugary drink consumption, I've also included a link to the Metrics website off of our public health website. And there, those that are research oriented could download the files that we used and the documentation and repeat or conduct some new analyses on the sugary drink data that we've discussed today. And as usual, my email and contact information is available as well. They keep me busy, but I'm always interested in responding to inquiries and people that are interested in the work that we do.
Great. Well, thank you so much. You've certainly painted a really vivid picture of what the data shows in New York State. Now we're going to take a moment to hear again from Dr. Kelly Brownell about what is the big picture looking like across the nation as we look at efforts around sugary beverages.
There's a lot of activity going on around the United States and in countries outside the U.S. to discourage consumption of sugar-sweetened beverages. There are educational campaigns. There's the famous Pour on the Pounds campaign that New York City did, but lots of other places are doing educational campaigns too to discourage consumption of the beverages. There are programs all around the country on getting rid of these beverages in schools. The schools really were the first frontier, and national legislation will kick in soon that will set quite good standards for what can be sold in schools and get rid of most of these sugary beverages. The mayor of Boston declared that it was not a good idea for the city to sell things that could make people sick on government property, and so the sugared beverages are out. Hospitals around the country are beginning to get rid of the sugared beverages. There are only a few of the things that are being done, but these are signs of a tide that I think is sweeping the nation with concern over these beverages. So I expect the beverage companies will have a problem on their hands in dealing with this, and that they'll try to respond by marketing very aggressively to offset the public health community's attempts to push people away from these beverages. But overall, they might very well become a product akin to the way the country's reacted to tobacco, where we think that these are just not good. Parents will teach their children, the message will be conveyed in schools, and the next generations will probably be drinking far fewer of these things than what you see today. My colleagues at the Rudd Center have undertaken very extensive research on the marketing of food products to children and published a report several years ago on the marketing of sugary beverages to children. And the picture is appalling. There is so much marketing of the unhealthy beverages to kids that it's no surprise that they're drinking these things in large amounts. And they're not just the type of things we would consider soda or soda pop, but it's all these sugary drinks that are marketed specifically to kids. Sunny D, Capri Sun, stuff like that, and Kool-Aid and all those sort of things are big players in this. There was a report several years ago by leading nutrition experts on how much physical activity you needed to do to require some electrolyte replacement, which is what these sports drinks are all about. And they said that it would take about the equivalent of a 100-mile bike ride in order to get enough activity where you would really need these things. And so the fact that these are being so aggressively marketed and the kids are consuming them thinking that they're healthy for them, when the vast majority of kids aren't doing enough activity to merit these kind of drinks, is a real concern. And kids may feel like when they drink these things they're given a free pass, that somehow they have some magical properties that offset the fact that they're just consuming sugar water with things that probably aren't even necessary for them. That's a real concern.
So Melanie, we've heard from Ian looking at the picture in New York State. We've heard from Dr. Brownell looking at the picture nationally. I'd love to have the opportunity to talk to you now. You're representing Rockland County, and it's going to be great to get some specific information about what are you doing locally. So talk to us. Tell us what you're doing in Rockland County, and how did you guys even get involved in working on this issue?
Well, within our Division of Health Promotion and Education in our health department, we focus very heavily on chronic disease prevention, particularly in the area of obesity. And so reducing sugary drinks has been a part of those efforts over the years. But in 2011, we applied for, and we're very lucky to receive, a $36,000 grant from the New York State Association of County Health Officials, also known as NYSACHO. And that grant focused specifically on reducing sugar-sweetened beverages in our community. So it was really at that point that we began addressing this issue much more comprehensively. Since then, we've also incorporated it into our worksite wellness program, where we provide technical assistance to employers in our county to try to create policies and environments that support a healthy workplace. And so in this case, supporting healthier beverages. So it's this type of work around sugar-sweetened beverages has become something that we are committed to and we plan to sustain in our organization.
Excellent. It's great to hear about organizations taking steps to try to promote health. Now, one of the things that you did in your campaign was define what do you mean by a sugar-sweetened beverage, because we've been hearing about, it's not just the soda. So talk to us a little bit about, in your organization, how did you define what beverages you were even talking about?
Yeah, this was a really important piece of our educational effort. So, the public often hears things in the media like the soda tax and the soda ban, and so they are aware that soda falls into this category of sugary drinks. But what we found was that there was a lot of public misconceptions about the other types of beverages that are sugar-sweetened beverages. And so that seems very similar with what Ian just presented on in terms of the public perceptions. So as part of our efforts, we made sure that we discussed all the different types of sugary drinks. And they include the energy and sports drinks, sweetened teas, lemonades, fruit drinks. Many of those fruit drinks don't have any fruit in them whatsoever, but the public tends to get confused by that. Sweetened coffee beverages, and really any beverage that contains added sugar.
So yeah, I think the first point of kind of clarifying what do you mean by sugar-sweetened beverages, it is, I know for myself it's even been kind of a misconception in terms of what things are we looking at, what falls into that category. Now, so you defined what you meant by sugar-sweetened beverages, and then where did you go from there? What were the goals of your campaign?
So our overarching goal was obviously to reduce the availability and subsequent consumption of sugar-sweetened beverages in our community. And our plan to achieve that included 3 major activities. So first, we wanted to implement an awareness and media campaign around sugar-sweetened beverages. We wanted to educate both our own employees as well as the public about why this was an important topic to address. Secondly, we wanted to improve and modify the vending machines within all of our county-owned buildings. We wanted to make a positive impact on our employees, on our visitors, and also serve as a role model for the types of changes we'd like to see in our community. Lastly, we wanted to partner with other sites, specifically employers in our county, to try to create environments that support healthy beverage options.
Great. So why don't we start by talking a little bit about that first objective that you mentioned about the media campaign. Can you talk to us about how you went about doing that and what was involved?
Sure. So we started the development of that campaign by partnering with New York City to use and modify their very successful Pouring on the Pounds campaign, which I'm sure a lot of the viewers have seen elements of. It's a really fabulous campaign. So we signed a publication use agreement with New York City, and that provided us with access to all of their materials. So we actually used our grant funds to hire a consultant, and that consultant was able to modify those materials and really customize them to our needs in Rockland County. We also were able to create some additional materials that utilize similar types of concepts from the Pouring on the Pounds campaign as well.
And can you describe some of the different components of the campaign that you implemented?
Sure. I also wanted to just quickly mention that if a company or an organization wants to use New York City's materials, they can contact New York City. It's their Health, Media, and Marketing division. And they'll be able to complete the same type of publication use agreement form that we completed, and they'll have access to those materials. So it's really a great resource for organizations to get some free materials on this topic.
Yeah, that sounds like a great resource, and I'm glad you mentioned that, because certainly, everyone's trying to make the most bang for their buck and get the word out, so that's a great opportunity for other organizations.
Absolutely. So in terms of the components of the awareness and media campaign, we tried to utilize a lot of different components to reach as many segments of our population as we could. We created several print materials in English and Spanish, and they included flyers and fact sheets, posters. We created these very small little wallet-sized cards that showcase the different calories in common beverages. And since we developed those materials about a year ago, we've already distributed or displayed over 5,000 pieces of them, so there really has been quite a demand from our community to share those materials, which we're very happy about. Another component of our campaign included both visual and audio advertisements within our county buses. So that element did have a cost associated with it, but we were also able to place brochures in a display unit behind the driver on each bus, and we were able to do that for free because we do have a county-operated bus system. So for other municipalities, maybe that's something worth looking into. We got a lot of great testimonials from that bus campaign, specifically from healthcare providers. Their patients and clients were seeing these ads on their way to their appointments and were mentioning them, and then they would come back and tell us. So we were really pleased to get that kind of feedback about that portion of the campaign. We also did some advertisements on the entrance and exit doors, as well as on the directories of the Palisades Center. That's a very large mall in Rockland County. And we actually did that during the holiday season last year, so as a result we got a lot of traffic and a lot of views just because of the timing of the year. And then the last element, we edited New York City's really fabulous Pouring on the Pounds commercials, and we included our local information at the end, and we played those on a variety of television channels in our area. So again, that piece did cost money, but the clips themselves are readily available on the internet, so I would encourage other places to consider posting them on their website or sharing them on their Facebook and really getting that message out.
Great. I mean, in looking at the visuals that you've shared and that are available on the handouts, I mean, these certainly seem like great resources for organizations to use. I also think, the commercials, I've seen them myself, and we're going to take a moment now. I'd like the audience to have an opportunity to view one of those Pouring on the Pounds commercials to see just how effective these media materials are. I really do love those commercials. I think it's such a great way to visualize, to show how much sugar is actually in one of those beverages, because it can seem like such an abstract concept, but when you put it out there visually like that, I mean, it is kind of appalling to picture somebody sitting and just downing 16 packets of sugar.
Sure.
Now, in addition to the commercials and the bus promotions and things of that nature, you also did some point of purchase messaging. Is that correct?
Yeah, so we really wanted to create a cue to action by placing these messages in locations where an individual is faced with the decision of what beverage to buy or consume. And so we created and displayed these make the healthier choice, choose water, seltzer, or other unsweetened beverage decals, or like little clings. We placed them on all of our county vending machines, and we also displayed posters near the vending machines. We put both of those items on refrigerators, in our employee kitchen, in our cafeteria next to the fountain drink. So we tried to put them in places where people would see them when they were determining what to consume. We also shared those materials with other organizations in our county so that they could also implement point of purchase messaging, and many of them did.
That sounds like an excellent idea. Now, in addition to putting the message out there, hey, make the healthier choice, you also chose to modify what's in your vending machines as well. Why would it be important to modify what's in the vending machines?
Well, from the data, and probably the slide that you'll take a look at in just a second, we know that supermarkets, fountain drink purchases, and mass merchandising stores do make up the largest proportion of carbonated drink sales. But vending machines still represent about 13% of the market share, and that's a significant amount. In most of our county buildings, vending machines are the only location that an individual could buy a beverage. And so between our employees, our visitors, we knew that making this type of positive change could potentially impact about 3,000 people daily. So for us, it really made sense to focus on the vending piece of the equation.
Sure. So what did the process look like to undertake if you're trying to restructure everything that's available? How do you go about doing that?
Yeah, it was quite a long process, but we started by obtaining a copy of the existing vending contract, and we wanted to see, was there anything in there related to health? And at that point, there really wasn't. We next used an intern to complete a visual pre-assessment of each of our county-owned vending machines. So we looked at the different products that were in the machines, we looked at the price, we looked at how these items were placed, and we did all this to try to establish a baseline for improvement. We then met with our purchasing department. We also met with the vending company, and we shared with them our recommendations from a public health standpoint and tried to elicit some feedback from them about the next steps that we should take. At that point, they were able to provide us with a list of all the available beverages that they had within their distribution. And we used that list to create an employee survey. So we surveyed our employees to try to find out which of these healthier beverage options that are available, which are the ones you'd be most likely to purchase, which are the ones you'd like to see in our vending machines. We got a great response to that survey. I was shocked by how many people actually replied, and they had some wonderful feedback and were thrilled that we were moving in this healthier direction. We also followed up with some taste tests to try to, again, get the employee buy-in and make them part of the process. And then we developed our final policy, and we were able to get the wording from that policy inserted into our vending bid and vending contract to try to make this a really sustainable change. And we're currently in the process of implementing that new product mix, so we're very excited about this process.
That sounds very exciting. Now, if other organizations wanted to go ahead and do this, if it would be effective for them as well, would it be the same process across the board? Is that something other organizations could do?
The process would probably depend, so it may be very similar. There's certainly elements that I would recommend regardless, like the taste test and the employee survey. In our case, as a government agency, we were dealing with contracts. We were required to do a bidding process. We had involvement from our purchasing department. So the process itself was sort of lengthy, but we've worked with other companies in our county. In fact, just recently I worked with a company in the last couple of weeks, and they were able to make these changes in a matter of a couple of weeks because they just have a simpler relationship with their vending company, and they can say to them, we'd like these changes, and the vending company makes the changes. So it kind of depends on the formality of the relationship you have with your vending company.
That makes sense. Now, what types of changes did you want to see in the vending machines? What did the feedback say from your employees, and what was important to you guys to make changes?
Well, we looked on the internet and we found some really great guidelines and standards and policies that other places had implemented, and we used those to try to draft recommendations that would be a best fit for us in Rockland County. We really wanted to provide people with a more proportional product mix and adequate selection of healthier alternatives. From our pre-assessment, we knew that there were some machines that didn't carry water at all. There were other machines where the water was regularly out of stock. And so for us, one of the main things was we wanted water to be a minimum of 2 rows or the equivalent number of buttons or whatever, depending on the type of vending machine. We also wanted water to be placed in the most prominent location of the machine, which is typically at eye level. And we wanted the sugary drinks to be placed in the least prominent location of the machine, which is generally all the way at the bottom. We wanted to also implement a pricing differential, with the water being at least 25 cents less than the sugary drinks. And lastly, we didn't want more than 2 rows of the machine to be sugar-sweetened beverages, and we were defining that as beverages that contained more than 25 calories per 8-ounce serving.
So in looking at the vending machine, I'm trying to visualize, if we've got 2 rows that are water and no more than 2 rows that are sugar-sweetened, what else goes into a vending machine? What are the other options that are available?
Yes, that was the hard part, is figuring out what other beverages are you going to have in there. So you'll definitely see things like the diet or 0-calorie versions of beverages. They're widely available. But we didn't want to just have diet drinks be our sort of healthier option. So we did try to find some other naturally low-calorie beverages. From our employee survey, the top 2 healthier choices that were preferred by our employees were unsweetened iced tea and club soda, which comes in a variety of flavors. So those are 2 other drinks. There's also some flavored waters that are on the market, 100% fruit juice, which we exempted from the sugar-sweetened beverage category because it doesn't contain added sugar.
Okay.
And then also, depending on the machines that you have, you might see things like milk or vegetable juice. There's a variety of other things, but it does depend on, what your vending company has available. Do you have a bottle machine or a can machine? At what price point do you want to sell these beverages? So it's kind of varies.
Okay, interesting. Now, in addition to modifying vending machine content, what are some other activities that an organization could do or could implement to try to make changes and take steps to reduce consumption?
Well, one easy thing is to practice healthy meetings. So whenever you're going to have a meeting or an event and you're serving beverages, be sure to also include a water or a club soda option, for example. You can also modify your vending machines or create a healthy vending policy similar to what we did. You can provide pricing differentials that support healthier beverage purchases, and you can do that in your vending machines or your cafeteria or gift shop, wherever you're selling beverages. You can also provide free water to employees with a water cooler or a water fountain, for example. You can provide taste tests of healthier beverages. A lot of times the vending companies are very willing to provide you with free samples to conduct these taste tests, so that's worth looking into. You can also implement point of purchase messaging. And lastly, really to spread this message and be an advocate for these types of changes, you can try to encourage these interventions with your partners in the community. Many of these activities can be translated into your public health work with employers, with schools, with corner stores, restaurants, and all the other facets of our community.
Excellent. And I think you've got that's certainly a comprehensive list of things that organizations can do, and it's really interesting about the vending machine suppliers being willing to do taste tests or provide samples. But I believe you have even more things, more suggestions that organizations can do as well.
Sure. Well, from an educational standpoint, we found that the educational piece of this was really essential for us in establishing buy-in and encouraging other organizations in our community to make sustainable changes around sugar-sweetened beverages. So there's a number of activities that you can do. You can distribute educational materials, and again, there's a variety of materials on this subject available at this point. So I referenced New York City's earlier, but there's others that you could look into. You can include articles and information about sugary drinks in your newsletter or any other publication that you have. You can post messages or videos on your website, on your social media outlets. You can also create visual displays that showcase the amount of sugar in common beverages. So this can actually be as simple as taking an empty beverage container and filling it with the amount of sugar that's within that beverage. We find that people don't always know what X number of grams looks like when they read it on a food label, but when you present it to them visually, it's very eye-opening, and they're often very surprised and interested to see it presented in that format. So we try to do that very often. You can also offer presentations on this topic. We recently started doing lunch and learns and offering that to our employers, and that's been going quite well. We've also offered community presentations to our Head Start, our school groups, and local coalitions. And we find that by doing these presentations, the group often follows up with us and wants to really make a more permanent change or do something more than just the educational piece. So.
Well, it certainly sounds like your organization has been taking a lot of action, getting involved in a lot of different ways to combat this problem. Have you received any feedback from the public about how your efforts are being received?
Yes, and I have to say, originally when we, began embarking on this campaign, I was not sure how the public or even our own employees would respond to this, particularly to the media element, because it is very visual and it's kind of in your face. But overall, the feedback has been extremely positive. We've gotten a lot of emails and verbal self-reports of reduced sugary drink consumption. So, sometimes people will come up to me and they'll say, well, I was about to drink this and then I thought of your ad and I decided to change, my order instead. So it's always nice to hear those kind of comments. And then also the feedback from the community has been great. A lot of nonprofits and schools and employers have taken elements of this campaign and implemented it within their own organization. So to me, that's the best kind of feedback.
That's really terrific to hear that, not only are you doing all of this work, but that people are receptive to it and it's starting to change people's actions, which is really the ultimate goal.
Absolutely.
Now, Melanie, again, we've got a couple of questions that have come in through the audience, but in addition to the information you've provided and questions we're going to answer, what resources would you recommend for folks if they wanted to find more information about what you're doing or where to get promotional materials?
So these are just a couple resources. Again, there's so many resources. If you'd like to learn more about our campaign in Rockland County or see some of the materials we've created, I would encourage you to visit our website. You can also contact me directly. I'm really happy to share our experience. The next resource is cutyoursugar.org, which is NYSECHO's website on sugary drinks. They have some great information about the other grant recipients and their projects. They also have some information about making vending policy changes. And I also wanted to mention that for people listening in the New York State counties, NYSECHO sent out over the summer a packet of some of the sample materials that we developed as well as the other grant recipients. And so if you're interested in more materials, I do believe they have some more, so you may want to reach out to NYSECHO. Another resource is New York City's Sugary Drinks page, and that contains some great data, some fact sheets, also the other videos similar to what we saw before. And lastly, the Centers for Disease Control has a campaign called Rethink Your Drink, which I'm sure a lot of the audience is already familiar with, but they also have some excellent resources for people to use.
Terrific. Thank you so much. Now, we did actually get some questions from the audience. So the first one is going to be for you, Ian. And the question is, what other sources of data could you look at to better understand this public health problem? Are there other data sources you would recommend? Or?
Sure, I could speak to three, two that really are from a population perspective, and then moving down to what tools could be used at a community level. So at the state perspective, we've also looked at data on purchasing of these beverages through grocery scanner data. Again, that's another way in which we could look at this behavior, understand what's being purchased and seasonality. Earlier I had talked about the idea of schools taking action to restrict beverages. So in our state, we're currently looking at the local wellness policies that school districts are required to have and submit to the State Department of Education. So we're looking at the percentage and number of schools that have already taken on their action on their own to restrict the beverages that are available. And another opportunity is there are a number of great tools that can be used to do retail assessments, so assessing what's available in retail outlets in the community. We have done a project in upstate New York where we've developed a tool and conducted these sort of community level assessments of what's available. I know New York City, who we worked with on this project, also has an assessment tool. And for someone who's interested in gathering information about what's available in their community, whether it be broad or narrow, I think those resources would provide some useful information.
Excellent, thank you. Melanie, the next question is for you. Okay. If your public health organization has limited resources to address this issue, what would be a good first step?
I think some of the interventions I mentioned towards the end, I know obviously our media campaign did include elements that had a cost associated with them, but some of these point of purchase things can be implemented without any money if you're able to maybe print some materials that are already available. And like I said, I'm happy to share what we've done and share what we've created so that people can use those. Definitely practicing the meetings, maybe creating some presentations that you can go out and do with your community. There's really a number of things. You just have to kind of be creative, and I know that funding is definitely an issue.
Sure.
Right now we're feeling it too, so we're trying to be creative and keep this momentum going.
All right, we've got just about 1 more minute to answer the last question. Ian, has there been any consideration for including alcoholic beverages in these population-based surveys or data collection processes?
We do collect that information separately. The indicators from a public health perspective that we're particularly interested are around binge drinking as a risk behavior. It's an interesting idea to also look at general consumption and then see how it correlates with sugary drink consumption. I know that that's also a source of excess calories in many people's diet.
Sure. Well, thank you guys both so much, and thank you very much for joining us today. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and again, continuing education credits are available. To obtain nurse continuing education hours, CME and PES credits, learners must visit www.phlive.org and complete an evaluation and a short post-test for today's offering. Additional information on upcoming broadcasts and relevant public health topics can also be found on our Facebook page. Don't forget to like us on Facebook to stay up to date. As a reminder, you can also download the companion guide to this broadcast on our website, phlive.org. The companion guide will provide you with learning activities to help further your knowledge and understanding of topics covered in today's program. An archive of this webcast will be available on our website within 2 weeks. Please join us on February 21st for our next broadcast, American Indian Public Health Disparities, Regional Differences in Health. I'm Rachel Breitster. Thanks for joining us on Public Health Live.